Welcome to the MamasteFit podcast. In this episode, this is the second episode of our labor stalls series, where we're going to be talking about how we can adjust labor stalls that are related to power or how strong our contractions are. So we're going to talk about some signs that may be associated with this labor stall and some solutions to help you find labor progress again. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. If you listened to last week's episodes, you learned about what a labor stall is and two reasons for labor stalls that include the passenger, so how is your baby positioned, in addition to the passage, which is the path that baby is moving through. We discussed some solutions and some ways to know that those are some issues, but it's important to note that there are different reasons for labor stalls, and each of them has a different type of solution. And so there's no one solution solves all. And so it's important to know why we're having a labor stall. So as a refresher, Roxanne, can you explain what is a labor stall and why this is a big deal? So a labor stall is when labor slows down or completely stops and your cervical change is not happening. So your dilation isn't happening, effacement isn't changing, and station isn't changing. And this is like after 4 to 6 hours, nothing has changed, as well as the intensity of your contractions has all stayed the same. These would be signs of labor stalls. And then this is when they would start to begin to recommend a C-section as the route of delivery versus the vaginal route, because labor is just not progressing. You can't just keep doing that forever. It is important to note, though, with labor stalls, some of us, our labors just take longer than others. Unfortunately, not everybody has like an 8-hour labor or a 12-hour labor. Some of us take longer to progress through the different stages of labor, and that can be completely fine. So if you have none of these signs that we're talking about with the last week, with the contraction pattern, or even this week as we talk about power, if none of these signs seem to be applying for you and you think you're having a labor stall, it could not actually be a labor stall, and it could just be your personal labor timeline. We just wanted to add that in there. That is true. Sometimes it's just slow, especially at the beginning. Early labor can take forever.
Yes, it can. Especially first baby.
And it's not an indication of an issue, especially if there is change between a sort of cervical exams or if you're noticing some changes in like intensity level or your movement pattern. Like these are all signs that things are changing. It might just be slower than you want it to be, which is always very sad. So let's talk about what a power stall is. And so power is related to the strength of our contractions. So how often are you having contractions? And then how strong are these contractions? And there's a number of things that can be associated with why your contractions may be spacing out or they may be weakening in intensity. The first is going to be you are really tired. It can be really normal for your contractions to space out if you're feeling very fatigued to allow you to sleep and to rest. And this is especially normal during early labor. So if you've been laboring for days and you're exhausted and all of a sudden the intensity of your contractions is decreasing a lot, this is where like taking a nap, if possible, can be really beneficial. So if you're still at home and your contractions have kind of spaced out, try to sleep. If you can't sleep, like get in the tub. Sometimes that can be a really great place to try to sleep. I think Roxanne took a little like Benadryl and Tylenol to help her like kind of doze off. That's really only going to work if you're like in early labor. If you're like in active labor, that's not going to do much for you. But you can try to do different things to honor the fact that you're just feeling fatigued. Now, if you cannot sleep through your contractions, you've been doing this for days, this is where like an epidural can be really beneficial so that you can get some sleep. And sometimes I'll see that like once somebody takes like a good nap, they'll finally see like tons of progress because their body is able to finally rest. And so that can also be an option and then tool that's available to you. It can be hard to change your plan, especially if you were wanting an unmedicated birth, but it's important to know what tools are available to you during your birth in case your birth takes like an unexpected turn. So if it is lasting forever and you can't sleep and you're absolutely exhausted, getting an epidural to take a nap can be super beneficial to help address this labor stall.
So our uterus is a muscle, and this is why like sleeping can be really helpful because your muscle can only go so long without rest as well as food, nourishment. So if you have not eaten in 2 days, it is not surprising that your uterus is going to be tired because it's not getting any source of energy except for gusts of wind and ice chips, which is not surprisingly does not fuel any muscles other than maybe a little bit of hydration. So we need to fuel our body still with food. And this can be like easily like eatable snacks. Like a steak dinner is not a great labor option. I also don't know many people that want to eat a steak dinner in the middle of their active labor, but eating something that like you can easily chew, swallow to like get quick energy can be really beneficial. Some people will always ask like, well, they say it's not safe to eat during labor. And the reason that this is because like, back in the day when they were putting a lot of people to sleep, they were having what was called aspiration pneumonia, which is when you eat something and then you throw it up and then like inhale it into your lungs. So like all of your throw up is then inhaled. And this has lots of long-term, not great consequences afterwards. And like the healing could be very prolonged after childbirth because of this aspiration pneumonia. But it is 2024. It's 2024 now. Science and medicine have come very far since then, and they've actually done a research study that by withholding food from people in labor can actually lead to more consequences versus just letting them eat. And like 1 in a million people will have aspiration pneumonia. But like many people potentially will have like all of these interventions introduced into their labors because they're not allowed to eat during it. So like the risk benefit of like withholding food from people in labor, it's like it has a lot more risk than benefits.
So something that would be important to know is what is your hospital or your birth location's food policy? Is it you can inhale big gusts of wind as soon as you get admitted? Is it as soon as you get like an epidural, you get Pitocin, you can't eat anymore? Is it like a clear liquid diet? So being clear on what you can expect food-wise at your birth location can be really beneficial. And so my biggest recommendation is before you go to the hospital, please eat a meal of food.
Before you go to an appointment,
just make sure you are eating something. So it's really, really sad when somebody went to sleep. Their last meal was like 6 p.m. They woke up in labor and they were like, I need to run to the hospital. They got admitted for whatever reason, even though they were like 3 centimeters. And then the next time they eat was like 48 hours later.
After their baby's born.
Before you go to the hospital or you go to your birth location, if they have like a no food policy, please eat something before you go. Now, if you do want to listen to the clear liquid diet policy and that feels safest for you, which is totally fine, like sports gels, honey sticks, like broths, like there's so many like options that you can eat to still find some nourishment. It won't be probably as good as like having some fruit and some nuts and like protein balls and things like that, but it's still something. It's still some sort of nourishment that's going to help continue to fuel you. Like I've had I've had some clients who've had these labor stalls because they're starving, and then they have a banana and all of a sudden their contractions get closer together and their labor starts to progress again. And it's like, oh, wow, I'm so surprised. But again, we do want to honor the fact that some of you may not feel comfortable eating during your labor if that's your hospital's policy. And so these would be some of our tips for you to continue to eat some sort of nourishment that is within your hospital's guidelines if you do want to adhere to like clear liquid policy. Now, if you are not cool with like clear liquid policy, finding a birth location that does support that, can be really beneficial as well, because there are some birth locations that even hospitals that do allow their patients and support their patients to eat throughout their labor until like a certain point. So once they receive Pitocin or once they're continuously monitored, they can't eat anymore. And so being very clear on that can be really helpful for your birth planning.
So another thing that can contribute to a power labor stall is our hydration status. If you are dehydrated, one, your contractions are going to be probably a little bit more painful, as well as not super consistent. It'll probably be a little bit more irregular. As well as if you are overly hydrated, you have like a ton of water in your system, that could also contribute to labor stalls. So like being the perfect hydration with electrolyte balance is really helpful for our labor statuses. And one way that we can like maintain the balance is by drinking some electrolyte drinks, whether it has trace minerals, but having like optimal electrolyte levels in general can be really beneficial. And adding that into your like drinks during labor can be helpful. One of our favorite electrolytes is Needed's hydration salts. So they have 3 flavors, lemon, lime, and grapefruit. My personal favorite is grapefruit. One makes your drink pink. How cute is that? Who doesn't love pink drinks? But it has like a little bit stronger of flavor, I think, than the lemon and the lime. With their flavors, it is flavored with real fruit. So it isn't super sweet, or like I feel like the flavor is very subtle, similar to like a LaCroix versus a root beer. A root beer is like very flavorful, probably not something I'm wanting to drink during labor anyway. But the Needed hydration salt is like a LaCroix where it still has that flavor, but it's not like slaps you in the face kind of flavor like a root beer would. And I feel like during labor, you don't want too much flavor. I think it's like the perfect amount of flavor for labor support with still giving you all of the benefits of the electrolytes and the trace minerals. And obviously, we're huge supporters of Needed just in general. We love everything that they offer. So you can use our code MamastePod to get 20% off your first order or the first 3 months of a subscription with them at thisisneeded.com.
Another thing that may contribute towards a power stall is how you are feeling. And so some folks will say that there's a 4th labor stall reason, which is the psyche, but we think that that is included with power, and obviously everyone has their own
power
opinions.
is just you. It's just you as a person.
So we can argue with that till the end of days, but they essentially means the same thing. One of the reasons that can contribute towards the strength of your contractions decreasing is how you are mentally feeling. So if you're not feeling safe and supported in your environment, this can contribute towards a labor stall or impact your oxytocin release, which is helping to increase the strength of your contractions. So if you're feeling very afraid, or like let's say somebody is causing a lot of tension for you or is like really making you very anxious, that could be something that could contribute towards a labor stall. Something else that can contribute towards a labor stall within the same psyche realm is you are afraid of something. Now, it could be that like you're being medically induced and you don't quite understand like what is happening, like you're really worried about your baby or you're worried about your own health and it just feels very unknown. Like this can contribute towards a stall because you're feeling very afraid of what's happening. Maybe like you had a prior birth experience that you would view to be traumatic and you're worried about it happening again. Maybe similar things are happening in this labor for you and you're worried that you're going to be going down the same path and you don't want another traumatic experience. It could also be that you had family or friends that had like a really traumatic birth and you're really fearful that that's going to happen to you because they've kind of told you these stories so many times. It's been like really ingrained in you. And so understanding what you are afraid of can be super beneficial. Now, I would recommend addressing fears like before labor if possible, but if you're in labor and things are kind of slowing down, doing a fear release during labor can be super beneficial. And so essentially what a fear release looks like is we're going to dim all the lights. We're going to kind of set the mood. So we're going to set like our labor vibe. So dim lights, soft music playing. It could be whatever playlist you really enjoy of music that you like, but usually like on the spa side of things, you're going to find a comfortable position and you're just going to talk about what it is that you're afraid of. And ideally with people that you feel really safe around. So maybe it's your partner and your doula, your partner, your family members, but essentially like your emotional support team is going to be there with you. And you're just going to kind of voice out loud whatever it is that you're afraid of. And it can be as irrational as you want it to be. You're just kind of saying it out loud. So for example, for my clients that are VBACs, and they had a C-section that they viewed to be traumatic. And this is not to say that every C-section is traumatic, but in this situation, this was like a specific scenario where I used a fear release and it was really beneficial. So for my client, she had a general anesthesia C-section after baby went into distress. And so she was not awake for her C-section. And she was really concerned that she was going to have a similar experience or that her uterus would rupture, because that's like a big thing that everyone kind of pushes on you if you're going for a VBAC. Like, risk of uterine rupture is so high, is so high, is so high. And that's like a whole other episode on that statistic. And so her labor was just like not quite kicking into gear. It wasn't quite going into active labor. And so we kind of set that vibe, and then we just talked about it. And I was like, hey, like, are you scared that we're going to have a similar birth experience? And she was like, yes. And so once they have this like big emotional release, we can then talk about, okay, what can we do to help mitigate this? Like, what tools do we have to help decrease the risk of something similar happening again? What parts of our fears are not rational and not realistic things to be afraid of? Not to like gaslight anybody, but hey, like the fear of this is probably like the ceiling is probably not going to cave in on us. Like the building is pretty sturdy. Like, so like kind of addressing more of those irrational fears and being like, okay, we can't really mitigate that, but it's probably not like a big concern right now. Let's focus on the things that we have more control over. So for things that are controllable versus uncontrollable. And so once we had our big emotional release, we then kind of talk about different courses of action, different ways that we can kind of mitigate those fears and those concerns. And then usually labor starts to progress from there after a little bit. We just kind of set the vibe, we have that release, and then we just kind of like let it go. And then we can finally progress. Now, you could do this during pregnancy, which I think is a better place to do it.
Yeah, it's probably a better time to do it.
But if you do wait till labor, or let's say you didn't have a time to like address it, or something happened during your labor, like you suddenly found out that you're getting induced for a medical complication and you didn't have time to kind of process it, you're really concerned about baby. And so this is where like your provider can be really beneficial as well. If you're like not sure like what is going on, like having them come and explain like the complication to you in more depth can sometimes be beneficial, because you can kind of help understand like what's controllable, what's not controllable, what is like a realistic concern versus like what is not actually associated with this complication. Because sometimes you just don't know. Like not everybody knows what IUGR is and what that means for their baby. Like, and so you can kind of go off the deep end of like thinking like Google is not a good place to research things.
Google is not recommended.
No. So in some situations where like you're feeling fearful because you don't understand something, this is where your provider coming in, where your nurse coming in and explaining things a little bit more in depth can be really beneficial for you as well. And that can help kind of mitigate some of those fears or help you release those. But if your stall is due to the psyche, like you're not feeling safe or you're feeling very fearful of something, a fear release can be really beneficial. Like this big emotional release, and then we just kind of let it go and just accept what's within our control and what's not, and kind of surrender to the process. And know that we are with a team that is there to support us, to keep us safe, to keep us and our baby safe. And sometimes that can really help with labor progress.
And both Gina and I kind of did this in each of our pregnancies differently. With my first, I mean, we labored similarly. We're very, very long early labor. And then I realized I was holding on to a fear that my daughter was going to be too big, she wouldn't fit, and I just like, we cried about it, voiced it out verbally, and then, gosh, I think like 2-3 hours later she was born. 1 hour of that being in the car trying to avoid her from being born. But if you have not listened to my birth story, I think it's episode 4, I don't know.
For me, in my most recent birth, I was afraid that my labor was not going to progress. So in North Carolina, and I think in most states, you cannot give birth at home with a licensed provider once you pass 42 weeks. And I was at like 41 and 3. And so I still had some time, but I was like nervous. I was getting closer. I was like, surely I would give birth at 38 weeks. I did not. And so when my labor finally happened, it was just taking a really long time to progress. And I was sort of expecting it to be like really fast. A lot of expectations that I should not have had.
Well, I mean, your last one was pretty fast. Like both of our boys were quicker.
Were faster. These girls
like to stay in. They're holding on for dear life.
So my like fear was that my labor was going to stop and that I was going to make it to 42 weeks and then I was going to have to go to the hospital and get induced for postdates. And I was like, no. So once I had a big cry, I took a nap, and then things started to progress from there.
She ate some watermelon.
Just sobbing. But sometimes that big emotional release can be like just what you need to like let go and surrender to whatever is happening.
Just like in daily life as well, like a good cry.
So during labor
good, ugly
and
cry.
good,
And in
ugly
life
cry.
can be really beneficial.
So another reason for a power stall can also be related to your health.
So infection, this can happen during labor. It could either have been in place prior to labor starting, so you could have like the flu or some like the cold or something that could like kind of stimulate you into labor, or you can develop an infection during labor. So the most common infection that can develop during labor is something called chorioamnionitis, which is basically an infection of the amniotic sac where baby is living, and like the amniotic fluid, again, where baby is living. So if that is an infection that can then pass to baby, not usually great. It also an infection, if you've ever, had the flu or a cold, most of us have, I assume, have had some sort of illness in our life, all over your body. You just feel like achy and like you can't do the normal things that you would normally, like walking to your like closet. It's like, oh, like this hurts. Your uterus is a muscle. We've already discussed this. The uterus muscle is going to like react the same way our other muscles do when it is sick. So your uterus, your contractions are going to be more painful, as well as like when you touch your belly, it's going to be way more painful because it is infected. It also is not going to be able to work in the same way that it would if it wasn't sick. So just like you can't go run a marathon if you have the flu, because your muscles are just going to like be really tired. I guess you could, but it's not ideal. Like it would be very, very hard and not the greatest choice. Your uterus is not going to be able to like continue labor for a long period of time at the same intensity level because it is now sick. So with our health and like if an infection is happening, there are things that we can like do like to address it to hopefully prevent it from getting worse, such as starting antibiotics or giving you some medication if you have a fever to hopefully prevent it from getting worse, as well as protect baby for a little while. But moving towards delivery in this instance is usually more beneficial because we want to get baby out sooner rather than later so they don't develop an infection, as well as your uterus eventually is not going to want to contract anymore. And this could lead to your baby's not going to be born vaginally, as well as could increase risks postpartum of bleeding.
So some signs that you are starting to develop an infection would be having a fever. And then like Roxanne said, like your contractions are a lot more painful, like your belly is really painful to touch. The signs in your baby is that their heart rate is going to become a lot more elevated. So usually you might be more familiar with like really low heart rates would be bad, but also really high heart rates are bad. And this is usually a sign that baby is starting to respond to an infection as well. And so we're kind of left with like two main scenarios where we want baby to be born, but it depends on kind of where you're at. And then it's up to you to decide kind of your threshold of comfort. And so if you're pretty close to delivery, like you're pushing, but your contractions are spacing out because you're starting to get sick and you just don't have the power to really get baby out, this is really like an instrument-assisted delivery could be beneficial, such as the forceps or vacuum, depending on your provider and what they're most familiar and skilled at. If you're not close to delivery and baby is also starting to show signs that they're responding to this infection in a negative way, this is where the conversation about a cesarean birth could be really beneficial. But again, it's up to you to decide your threshold when it comes to labor stalls related to your health, because someone's comfort point of deciding as for a C-section is going to be really different than somebody else's. Like you may want to kind of push towards that vaginal birth if you're like pretty close. Let's say you're like 8 centimeters. You might be like, well, if we go for another hour and baby and I are still like looking somewhat good, we may have like a vaginal birth. Versus if you're like 4 centimeters, you might be like, okay, well, the likelihood of me suddenly progressing and pushing my baby out within the next few hours is probably not super high, but the likelihood of our health continuing to decline is much higher. Let's make a decision for a C-section now while we're both stable and still doing well. And so that threshold is really just kind of up to you to decide. Having conversations with your provider in that situation can be super beneficial. Conversations with your partner and what you guys feel most comfortable with. And then even conversations with like anesthesia, for example, if like you don't have any sort of pain medication or like an epidural yet, trying to decide like, okay, well, should we get an epidural now so that just in case we do deteriorate very quickly, I can be awake for a C-section versus like, well, we're almost there. Let me just finish this birth. So there's no right answer to deciding when you should make a decision if it's like related to your health or your baby's health. It's really up to you to decide like what your comfort level is, and having a lot of conversations with your team can help you kind of navigate this really hard situation.
And even with an infection, so if you start to develop an infection and your contraction strength starts to decrease because of that, we can still give you Pitocin to kind of increase the strength of your contractions. It doesn't become like oh, well, you're only 4 centimeters, so our only recommendation is like a C-section. You do still have options of like getting Pitocin to increase the strength of those contractions now to hopefully lead towards delivery and having a baby vaginally, because it is always the preferred option because it does have less long-term complications associated with it versus a C-section surgery. But knowing like you can decide, like if you start to have an infection, you always have that option of a C-section if you want to, but you can also like opt for maybe like if your water is not broken yet, getting your water broken, or maybe starting Pitocin to kind of expedite the delivery towards delivery quicker rather than like waiting for the infection to kind of just get worse. And they will give those antibiotics again to start trying to treat the infection to hopefully lessen the effects on baby as well.
So last week we talked about how Pitocin is not always the answer to a labor stall, especially if it's related to like your baby's position or like the space within the pelvis. Like typically like movements to help adjust baby's position and to create more space within your pelvis are going to be a little bit more beneficial to addressing those labor stalls. While for a power-related stall, which is related to the strength of our contraction, this is where Pitocin could actually be really beneficial. And now this is not to say that you couldn't use Pitocin if the labor stall was related to your baby's position or the creation of space within your pelvis. Sometimes a little bit stronger contractions can help rotate baby or help them engage. But commonly, we find that addressing those labor stalls with movement first can be really beneficial and usually going to resolve that labor stall to where you wouldn't need Pitocin. Now, when it comes to a power stall, if you don't have an option to sleep, you don't have an option to eat any food, like you're having a really hard time, like drinking any sort of fluids, or maybe you are starting to get sick or you're like really afraid of what's going on, this is where Pitocin could be a beneficial tool for you to help increase the strength of your contractions, get them closer together so that we can see labor progress again. So Roxanne, can you explain what Pitocin is?
Yes. So Pitocin has a lot of fear around it, first off. Like everyone is like the first thing that we ask anytime we have an induction as well as like augment somebody's labor, the first thing is like, I'm terrified of Pitocin. Like I don't want any Pitocin. Can we like avoid giving Pitocin? Because everybody has this like fearful like view of it that like labor is going to be so painful and just the worst thing
that's what I thought
anybody ever experiences with Pitocin. And it's because like that's how it's portrayed just by everybody. And Pitocin contractions are different. They are different. Pitocin works differently than oxytocin. So Pitocin or syntocin in some countries is just synthetic oxytocin. It might be other names in other countries. Pitocin is here in America is the name of synthetic oxytocin. And oxytocin is our love hormone. We release it to stimulate contractions, but we also release it when we feel safe, supported, loved, when we orgasm, when we hug somebody that we love. Like we release this oxytocin and it then releases this endogenous pain relief. It gives us this like a little bit of a euphoric feeling. We feel happy and like joyful. And it also decreases the amount of pain that we experience. So when you have spontaneous labor in oxytocin, your contractions are probably similar strength as a Pitocin contraction, but Pitocin does not cross the blood-brain barrier, so it is not releasing this endogenous painkillers like oxytocin does. So like they're probably similarly strength contractions, but oxytocin has like the pain relief, the natural pain relief to make it feel less versus Pitocin, you just feel it all. And then oxytocin and Pitocin are also administered kind of differently. Whereas Pitocin is just a continuous drip that they're going to maybe increase and decrease, most likely mostly just increase it as your labor progresses. And it's going to stay pretty much constantly flowing through your blood until you have a baby. The goal of it is always to decrease it and then turn it off. The number of people that I know that actually decrease it and eventually turn it off is maybe 1, maybe 2. Most of the time, people need it until they have a baby. But oxytocin, it is part of our positive feedback loop of labor. So oxytocin and prostaglandins talk to each other, and this cycle just continues. the oxytocin level is dependent on how much prostaglandins our body is releasing, and prostaglandins tell our brain how much oxytocin to release. So that amount goes up and down, and it like ebbs and flows throughout the entire time during labor. Like at one point you might have 6 milliunits of oxytocin, and that at the next it could be 10, and then it could be 2, depending on just like all of the different factors that are happening around you, the stage of labor you're at, as well as baby is releasing some oxytocin. Whereas Pitocin, again, it's like just a constant flow. If your contractions start to space out, they're going to give you more Pitocin. If your contractions get too close together, then that's when they would decrease the Pitocin to keep it 2 to 3 minutes apart, lasting for a minute with about 50 seconds to a minute in between. Whereas oxytocin will respond. If you're tired, it's going to slow down so that you can sleep. If you're hungry, it's going to slow down so you can eat. All of those reasons for a power stall is because oxytocin responds to how your body is feeling and slows down so that you can do whatever you need to do for it to then pick back up and continue. You get these natural pauses during labor. You don't get any pauses during Pitocin because if you're getting Pitocin, the point is to have a baby.
But there are things that we can do to enhance our oxytocin release so that we can use less Pitocin potentially. And so this can be things like the loving touch. So those things that are going to make you feel really safe and supported. So hugging your partner, kissing, like nipple stimulation, or using like a breast pump to like pump out a little bit of colostrum can also help with oxytocin release, which can help enhance your contractions. Setting your labor vibe room, so like decreasing the light, so dimming them really low, playing some soft music, having everyone around you talk in very quiet voices or be mostly quiet. So like
Stop talking.
No telling like jokes and like stories about the past, like in super depth in the middle of your contraction. So doing these different things can kind of help enhance your oxytocin release, which could potentially decrease the amount of Pitocin that you need to increase the strength of those contractions. But again, it's okay if you need to get Pitocin, if that is what's going to help your labor progress, if the issue is due to the strength of your contractions. For me, during my first labor, I was very afraid of Pitocin. I took a birth class that told me it was evil, and I embodied that viewpoint. I unfortunately was not able to communicate clearly to Roxanne how fearful I was, and she was just like, it's fine, and gaslit the shit out of me.
I was also like very stressed. I just moved to North Carolina like a week before Gina had her baby.
It's still gaslighting Roxanne. Now she understands a little bit more about what I was feeling, but I was just really afraid of Pitocin. And that probably contributed towards why I went so late.
She was mostly afraid of Pitocin. I remember it. I was also a nurse for like 2 years. So I'm like, Pitocin, like everyone gets Pitocin. Why are you so fearful of it?
So I was terrified of it because I wanted a medicated birth, and everything told me that Pitocin would make my contractions unbearable. It would make them so painful, like that I would be crying for an epidural. And so I just saw it destroying my birth dreams. What I now understand is when they give you Pitocin, it's not like 1,000 from the start.
Yeah.
It's not a 0 to 100. It's like a 0 to 5 miles, and then 5 to 10, and then 10 to 5 miles per hour. Like not milliunits. Like it's a slow increase. Like it's not as soon as they administer to it, you're like hanging on for dear life. It's a gradual build, and they're only going to increase it to the point that like you need it to. So not everyone's going to make it to the max amount of Pitocin possible.
Hopefully not.
Hopefully. It is a slow build, and so it's not like immediate death. And it doesn't even make it to that point either. I don't think it's like excruciating. I think there was so many other factors for me that made that labor just so much more challenging for me that were not only related to the Pitocin. Like I didn't feel safe where I was. Like I felt like the midwife hated me. There was a lot of factors. I was very stressed out. And so with all of that, and then the Pitocin on top, it was a very stressful and hard labor for me. Had it been just the Pitocin and I was much more calm, might have been a little bit different.
I mean, people have Pitocin births, unmedicated births with Pitocin, either induction or augmentation. And labor is hard. Like just because you went into spontaneous labor does not mean it's going to be pain-free. Unless some people say it's pain-free. Most of us will experience pain with our contraction or discomfort. Maybe discomfort's a better word. Just because you go into spontaneous labor does not mean that you're going to have zero discomfort during your labor. And if you had a Pitocin-induced contraction, it is going to be 10 times harder and unbearable and very painful compared to other people's labor. Like, you both are experiencing discomfort. It's just a different type.
So I definitely think there's a lot of other factors that we need to take in consideration when it comes to how we're going to feel during our labor, besides just what intervention that we may need implemented. It's important to note that birth interventions are not evil, they're not wrong. If you get one, it doesn't mean that you failed in any way. There are different tools that are available to us to help enhance our labor experience and to enhance our labor progress. In some situations, you may need Pitocin to help with your labor progress. In some situations, you don't need it. And so it's important to know in what situations this would be your preference and in what situations you would like to explore some other options first and understand what alternatives that you have. And so this is like a great thing to ask your provider, hey, if I need my labor augmented, if I need to be induced, what can I expect from you? What does your clinic typically do when it comes to induction? Like, what other options do I have if I have to be induced besides just Pitocin? Like, what can I explore first? How effective are those other options? And so these are things that we discuss in our childbirth education course because we want you to feel empowered with whatever type of birth that you choose to have and whatever type of birth you end up having, because we want you to feel that there are different options and tools available to you to feel confident about which one of them is best for you in different situations, because not all of us are going to have this like perfect linear birth where everything happens exactly in this way.
Not even we did.
Yeah, there's going to be some different hiccups along the way and some unexpected turns. Now, that's not to say that you shouldn't plan for birth or that you shouldn't prepare for birth by any means, but you should understand your preferences in these different scenarios. So, hey, I don't want to immediately show up at the hospital and get Pitocin, but if I'm in this situation, I would be willing to have a conversation about Pitocin. Or before I make a decision about Pitocin, I want to try some nipple stimulation and kind of do some fear releases and then have a conversation about Pitocin. Or, hey, I'd rather would explore these other things first before I even want to have a conversation about Pitocin. Or maybe it's like, hey, if my labor is stalling and I need some help getting my contractions closer together, I would like Pitocin right away. And so being comfortable with these different options and knowing in what scenarios you want them can be really beneficial. And that's what we discuss in depth in our childbirth education course. So a lot of our students report back to tell us, hey, my labor did not come back the way that I thought it would, but I felt really good about it the whole way because I felt like I was able to make confident decisions and it helped me stay in control and be the primary decision maker, because that is what helps contribute towards a positive birth experience.
And it's so important to note that, like, with any intervention in labor, especially with labor stalls, like, you can always either change your mind or, like, if you are having Pitocin and maybe the contractions are getting a little bit too much for you and you just need a little bit of a break when maybe your body would naturally give you a pause, you can always ask them to turn it off. They might give you some pushback to be like, well, if we turn this off, like, all progress, like, the train will stop and like the progress will stop and we'll just have to restart again. And you could be like, got it, but I really need a break right now. And that should be enough. Like, if you no longer give consent to receive a medication, they should turn it off.
And sometimes those breaks can be beneficial to labor stalls as well, because sometimes we have too much Pitocin kind of flooding our system to where our receptors can't do anything with it. And so it can be nice to just totally turn it off, eat a meal, take a shower, maybe even sleep.
Pitocin breaks.
And then reset and try again. And so sometimes that can be something that helps address labor stalls too.
That could be that if you are being induced and nothing is happening, and maybe you've been on Pitocin for like 16 to 24 hours, it could be definitely beneficial to have what we call a Pitocin break, because we only have so many oxytocin receptors in our body. Similarly with like any drug, like we can only give you so much medication that is actually going to attach to receptors. And sometimes you could have too much of something that there's not enough receptors to attach to. So you need to like kind of use up the medication that's in there and like let it out of your system before maybe like restarting. So it's like it's like at least a 30-minute to hour break off Pitocin to allow all the Pitocin to leave your system. And then you start back up again. The receptors are free and available to hopefully attach to maybe some oxytocin that's in there, but also to the Pitocin. And this could decrease risks of postpartum hemorrhage as well as potentially allow labor to progress.
So obviously we can talk for a long time about Pitocin, and we'll probably have to do a whole episode that's just about Pitocin and addressing those fears. But in this episode, we were talking about the labor stall power. So that's related to the strength of our contractions. So how strong are your contractions? How often are they happening? And there's a number of things that can contribute towards this labor stall. And it's important to note that this is different than labor stalls related to your baby's position or the passage or how much space there is within your pelvis. Those labor stalls are typically going to be addressed with increased movement and doing different things to try to adjust your baby's position. While a power-related stall is usually going to be related to things with your own health. So are you sleeping enough? Are you eating? Are you hydrating? Like, how do you feel? Like, mentally, do you feel safe and supported? And then what is your health? Like, are you sick right now? Is that contributing towards a stall? You can either address each of those issues by taking a nap, eating some food, hydrating more, like doing a fear release, or if we're getting sick, getting medication to help address that sickness. Those can all be things that help resolve this labor stall. Another thing that can help resolve the labor stall or to increase the strength of our contractions would be that Pitocin, so helping to enhance kind of that oxytocin release. And we can do other things to help with our natural occurring oxytocin release, such as loving touch, kissing, hugging our partner, even just holding hands. Physical touch is a great way to release oxytocin. Nipple stimulation, either with your hands or with a breast pump, which is what I usually find to be a little bit more beneficial because we get tired.
Your fingers get tired after a while.
So a breast pump can be really beneficial for that. You can also explore other induction methods, such as having your water broken, getting a Foley balloon. Like, you can explore other things that maybe your body just wasn't quite ready for the contractions to start happening if you were being induced, for example. So there's lots of options out there. Having a really great conversation with your provider, prenatally, on what to expect if you have a labor stall. And then also during your birth, if you are experiencing labor stall, having a conversation with the provider on hey, what are my options right now? What should we explore? What are your recommendations? What are you thinking? Can be really helpful, especially in those situations where your health is starting to decline, and kind of figuring out where your comfort level and where your threshold is in continuing for a vaginal birth versus making a decision for a cesarean birth.
And just to note again, you already said it, but with labor stalls, if your labor is taking a very long time and maybe you're not making a lot of progress in a 4 to 6 hour period, note that it may not actually be a labor stall and just your personal labor pattern, and you might just take a longer time to get through that early to early active labor timeline than other people. So knowing that unless you're having some of these symptoms, maybe you feel like your labor has been taking forever, so you eat and you sleep and you do all of the things that maybe will address a labor stall and nothing happens, that it could be completely normal. And your labor will pick up and progress normally on its own timeline, because we all have our own timelines for our labors, and it might not actually be a labor stall.
I'm a big fan of assuming that most things are pretty normal and we're just going to keep moving and eating and drinking, and things tend to usually progress from there, as opposed to assuming that everything's a problem.
Most of the time I find with labor stalls, it is pretty apparent that something is wrong. Whether we see it and be maybe something's going on, and then they're I feel like something is off. And either baby's position is off, or something with their labor is taking longer, and they can feel it in their own bodies, because we are very intuitive beings, and you likely may know that something might be off.
You're the smartest person about your own birth.
Yeah. So
if you want to learn more about labor stalls and you want to learn more about your birth options to help you plan for birth and to navigate these different scenarios, join our online childbirth education course. If you want more support with finding all of those different types of movements to ensure that you have the movement capability to open your pelvis for birth, join our prenatal fitness programs. We incorporate strength training exercises, pelvic stability exercises to keep you strong and comfortable throughout your pregnancy, plus those pelvic opening and pelvic floor release exercises to help you prepare for birth. Because we don't have to wait till birth to figure out how to create space within our pelvis to decrease the number of labor stalls that we may experience. If you're postpartum, though, you just happen to listen to a birth episode, you can join our postpartum fitness courses, or maybe you're close to the end of your pregnancy and you're it's too late for me, even though it's never too late to join any of our programs. You can join our postpartum fitness program to help you get back to fitness. We even have a free early postpartum recovery course that is our gift to you. That's about 4 weeks of just gentle breathing, some core exercises. It's really low key, low stress. It's okay if you don't do every exercise. It's free. It's not a big deal. And then we also have our postpartum education course that now includes infant CPR and infant massage to help you feel confident to address any emergencies with your baby or some emergencies with your baby. I guess there's always some that we don't educate on. And then infant massage to help you bond with your baby and help them feel better. If you're a professional, you can join our birth workers course or our fitness trainer course so that you can learn online with us and earn CEUs. They're all self-paced. You have lifetime access. So they are big courses, but you can start them now and just slowly work through them for however long that you need.
Some people take a year plus, and that's fine.
And that's totally fine. If you enjoyed this episode, be sure to like and subscribe to our channel so you get notified whenever we release new episodes. We release new educational episodes on Wednesdays and new birth stories every Friday.
This podcast is sponsored by Needed, a nutrition company focused on the perinatal time frame, and you can use our code MamastePod off your first order or the first 3 months of a subscription at thisisneeded.com.